Let's talk about clitoral adhesions. Let's talk about clitoris. Clitoris is the amazing organ made specifically for sexual pleasure. So the little nubbin that you see is the gland of clitoris and the clitoral hood, but there's a whole big structure underneath the skin. So sometimes there are adhesions formed between gland of clitoris and the clitoral hood. There are a few reasons to develop clitoral adhesions. One is because nobody tells girls to retract the clitoral hood. And it's very important to keep manually retract and clean under the hood every day when you take a shower. Some old skin cells, some smegma, can promote development of the adhesions. Also, prolonged use of hormonal birth control can increase risk of developing adhesions. Certain skin conditions, for example, lignin sclerosis, predispose women to develop adhesions. In some cases, adhesions can be quite severe and close completely the gland of clitoris. We call it a clitoral phimosis. So how would you know if you have clitoral adhesions? Majority of women are symptomatic. Some women might experience diminished orgasm, or it might take longer to achieve an orgasm. Also, in some cases, women might develop a persistent genital arousal disorder. It means that they constantly feel on the verge of the arousal, on the verge of orgasm, and it's very unpleasant feeling. Sometimes there is a keratin pearls formed between those adhesions. It's basically smegma that keratinized and just being stuck in those adhesions, constantly irritating the tissue. There are a few ways to deal with clitoral adhesions. Majority of adhesions can be removed in the office under local anesthesia just by manually stretching the adhesions with a special instrument. More severe cases might require a trip to operating room where we can remove those advanced adhesions. It's also very important to address the underlying cause. For example, if the adhesion happened due to the lack of hormones, it's important to use the hormonal cream, like a cream containing estrogen and testosterone, to prevent those adhesions from forming. If the cause of your adhesions is lignin sclerosis, you need to continue using high-potency steroids on a regular basis to prevent those adhesions from recurring. In all those cases, it's very important to keep retracting your clitoral hood on a daily basis. You can think about the clitoris as the anatomical equivalent of the penis, where the head of the penis is the gland of clitoris and the foreskin is the clitoral hood. I generally recommend examining your genital area with a mirror. Try to retract the clitoral hood so you can see the whole glands of clitoris. If it's not possible, make sure to see a specialist who can examine your clitoris for you and determine if you have an adhesions. So if you're someone who is noticing some changes in your clitoral area, it's very important to address early on, because this condition can get worse as the time goes on. Just remember, it's a very common condition, but it can be addressed once you know that you have it.